After she sends her 2 young boys off to school, 34-year-old single mom Jeanette Maria boards a bus for the hospital near her rural town in Denmark. For several years, starting around 2007, she complained to her doctor about bad headaches and feeling exhausted and nauseous all the time. But she says he told her the symptoms were all in her head.
Men på et tidspunkt går jeg ind og googler mine symptomer.
At one point, I go and Google my symptoms, and kidney disease comes up. And I show that to my doctor, but he says, like he said those other times, there's really nothing wrong with me.
Turns out she did have kidney disease, and now, 3 days a week, she spends 5 hours hooked up to dialysis. Without a kidney transplant, she'll live like this for the rest of her life. Back in 2006, Steen Larsen felt a bulge in the back of his throat.
Then going to the specialists, and they pretty fast confirmed that this was cancer and had to be treated.
Aggressive radiation treatment was supposed to begin within weeks, but there was a backlog at the hospital, and so his treatment was delayed by months. His tumor kept growing, and his chances for survival went down.
How much did it grow?
It was on the way out,
Yeah.
outside of
You
my mouth.
could visualize it when he opened his mouth.
If these people lived in the United States and they wanted some compensation for what had happened with their cases, they basically have one option. You hire a lawyer and you take your case to court. But here in Denmark, they have a very different approach.
Instead of suing your doctor or hospital like we do in the US, here you direct your complaint to this office, the Patient Insurance Association. Martin Eriksson is the deputy director.
So let's say I'm a patient and I believe that I've been hurt by a doctor or a hospital. What do I do?
All you have to do is actually to fill in a claims form. You can even fill it in on our webpage.
So you don't need a lawyer?
Don't need a lawyer
Does it
at all.
cost any money to file?
It's absolutely free for the patient. Only have to fill in the claims form. That's all he has to do.
The patient's complaint about their injury then goes to an independent panel of lawyers, doctors, and administrators. There's no courtroom and no testimony. They examine a patient's medical records and hold it against this standard. Would an experienced specialist in the field have acted differently, thereby avoiding the injury? If so, then a patient is offered compensation, all paid for by Danish taxpayers.
So now's the time when they will get the full compensation.
For complaints about specific doctors, there's a totally separate, also non-judicial process for dealing with those cases. The Danish system is just 20 years old. Before, they had a system very similar to the US, where injured patients took their complaints to court. But like in the US, the criticism was that system was painfully slow and served only a few patients. Under the current Danish system, an estimated 30 times more patients are compensated, and they get paid much more quickly, on average within about 6 to 7 months. Payments average roughly $50,000 US and are capped at about $2 million. The goal is to mostly cover lost wages, not huge amounts for pain and suffering.
If those amounts sound stingy to Americans, it's worth remembering the Danish government provides very generous social safety benefits to all its citizens, including taxpayer-funded universal access to health care. So, unlike in the US, Danes don't often go bankrupt because of staggering medical bills, and they don't have to sue to protect themselves.
It's kind of icing on the top of the cake, this system.
Some Americans might look at the Danish system and believe that there's not a strong enough advocate for the patient in this. Here you're having decisions made by lawyers and doctors who you never know or may never meet. Do you feel that there is a proper champion for the patients here in the system?
I hope we are the proper champion for the patient in this system. We are supposed to be. And we have lawyers that are specialists in these kind of cases, handling the patient and looking out for the best interest of the patient. I think we do that.
Another feature supporters point to with the Danish system is improvement in the relationship between doctors and patients. Not only do they not face off in court, many doctors in Denmark actually help their patients file their initial claims.
We don't have this threat of being sued, so it's just normal for us.
Dr. Charlotte Wilken Jensen is head of obstetrics and gynecology at a large regional hospital just outside of Copenhagen.
We know that we make mistakes, and we know that there are systems that take care of those mistakes, not in the medical way, but outside the medical system. We tell the patient about it, and we tell her about her opportunities.
To get compensated.
Get compensated, yeah, financially.
In the U.S., OB/GYNs pay huge amounts for malpractice insurance, easily spending 6 figures each year. Danish OBs, on the other hand, carry little, if any, such insurance. Wilken Jensen also says she's never felt the pressure, a pressure that many U.S. doctors feel, to practice so-called defensive medicine, which means doing additional tests or procedures just to guard against possible lawsuits.
As a doctor, as a health professional, you're always afraid to make mistakes because it can have very serious consequences. You do not want to do harm, not for money, not for any legal causes, but because of your integrity as a health professional. So usually it's a very fine relationship.
Another interesting feature of the Danish system is the way in which they keep information on the incidence of medical mistakes. In the United States, probably because of the fear of litigation, information about errors made by doctors and hospitals is not shared very widely. Here in Denmark, however, that information is widely available to researchers who might want to use it to try and improve patient safety.
And the baby's active?
Yeah.
Every day?
Yeah, she kicks a lot.
Dr. Morten Hedegaard is also an OB/GYN, and he runs the department at Denmark's biggest hospital.
Heart beating here.
As a consultant to the Patient Insurance Association, he reviewed numerous cases where pregnant mothers came into maternity wards to deliver their babies. But during delivery, medical staff misinterpreted test results, signaling that the unborn children weren't getting enough oxygen.
The worst cases will end up the baby dying or the baby ending up with a lifelong disability, especially cerebral palsy. So I think it could be extremely interesting if we would be able to prevent these kinds of cases to happen again and again.
Hedegaard is now designing a nationwide program to improve the training of maternity ward staff across Denmark. The goal? That more babies can thrive, just like this little girl.
Right now we are in the middle of the project, so it's too early to say if we're going to succeed. But our aim is to reduce the problem by 50%.
First and foremost, however, the Danish system is meant to help injured patients, and by most accounts, it does that successfully. Even though people can appeal the Insurance Association's decisions, only 15% do. Jeanette Maria was one of them. Back in 2010, Jeanette filed her claim. The Insurance Association agreed that her doctors missed that her kidneys were failing, and they told her she'll get some compensation. But they also determined she'd have required kidney dialysis no matter what.
Again?
Jeanette disagrees, and she's worried the compensation won't be nearly enough to offset how severely her life's been changed.
I was told that if I was lucky and everything went well, I would have 30 years left. I need to know I can secure my children's future. Money cannot make up for what has happened, not at all. The situation is the way it is, but I hope it can help my kids in the future when I'm no longer around.
Jeanette filed a relatively rare appeal, which is as simple as writing a letter, but like nearly 98% of appeals, it was denied. She'll be notified what her final compensation will be in a few months.
This one is the actual claim we filled out.
Steen Larsen and his wife Inga filed a claim because of the long delays in his cancer treatment, and after about 6 months, they received a total of $10,000. Again, all done with no lawyers, no courtrooms, and very little paperwork.
They would compensate us and they say how we would get the money.
In the meantime, Steen's cancer treatment went forward, and they believe the cancer has been knocked out.
Is that $10,000, is that a satisfactory amount? Do you feel like that was what you deserved, what you were owed?
Actually, we did not go for the money. It was nice to have a bit of compensation, but you also have to think about that this money, they go from the hospital, and it's taxpayers' money. So, I mean, maybe they were better spent increasing capacity at the hospital than paying out huge amounts to individuals.
So part of your complaint was to say, don't let this happen to someone else. The next person who comes in with cancer, treat them right away.
Yeah. That was actually our motive for filling in the complaint. We're just happy that he survived. I mean, he's free of cancer. We are living almost a life as we did before.
It's okay. I feel okay today.
Good.
I'm alive.